year on the 4th of February, the world comes together to mark World Cancer Day, a global initiative to raise awareness about cancer, to promote prevention and early detection and treatment, as well as mobilize collective action to address the global cancer epidemic. Cancer remains a major health challenge with far-reaching implications for not just patients, but their families and extended communities too. Joining us today for this conversation is Professor Dr. CHING, Chief Scientific Officer at Cancer Research Malaysia. Professor CHEONG, thanks for being with us today. Before we dive into World Cancer Day, cancer still remains a major health challenge in Malaysia and even Asia. Could you share with us the current situation, such as which cancers are most prevalent and which populations are being most affected?
Hello, Jessie. Thank you for having Cancer Research Malaysia on Bernama TV on World Cancer Day today. So cancer remains one of the top most common cause of death in Malaysia and also across Asia. And in Malaysia, breast, colorectal and lung cancers are amongst the most common cancers. But we are also seeing an alarming rise of more Asian cancers like head and neck cancer, particularly among the underserved communities. To me, what's even more concerning is that many patients are unfortunately diagnosed at late stage, what we call stage 3 and stage 4, when treatments are more complex and outcomes are a lot poorer. Unfortunately, this is particularly even more true in rural and low-income areas where access to screening and also timely diagnosis still remains a challenge. So at Cancer Research Malaysia, our work focuses on closing these gaps by developing locally relevant solutions where, whether it's an AI-powered screening tool or better genetic risk prediction for Asian populations, or even our patient navigation program like NORA, to help people and Malaysians access care earlier.
Well, Prof, you did mention Asian cancers. Perhaps you could just give us a little bit more understanding as to why this is occurring. Although you talked about early screening and it being affecting those from the low-income category, but then food and lifestyle, this surely too plays some sort of role in these Asian cancers. Give us a better understanding.
So when we talk about Asian cancers, we mean cancers that are predominantly diagnosed in the Asian population. So for example, 3 out of 4 oral cancer deaths, cancer of the mouth, is going to occur among Asians. So you can see these kinds of cancers more commonly seen in Malaysia, in Southeast Asia, and predominantly that's why we call them Asian cancers. So another type of cancer, such as nasopharyngeal cancers, can be up to 40 times more common in Southeast Asia compared to, let's say, in the US. So therefore, Cancer Research Malaysia has a focus on these kinds of cancers because they occur in our population and our communities. And of course, because they are rarer in America and the Caucasian population, investment in this research is lagging in these cancers. Therefore, if we want to make progress in terms of treatment, early detection in these cancers, we need to do it here amongst our population.
World Cancer Day 2025 to 2027 carries a theme, and that is United by Unique. Explain what this theme represents and why placing people at the center of care is so important.
I think the theme United by Unique is very special because it reminds us that while cancer is a shared global challenge, the way it affects each person, I mentioned about different kinds of cancers even in the Asian population, and how it affects each community is very different. So our research basically believes in placing people at the center of care. And what that means is designing interventions that are not only scientifically sound, but also contextually relevant to our communities. So that's the reason why we develop tools, for example, screening tools that are tailored to Asian risk factors. We train our community health workers in remote areas. We built AI models using regional data. And because equity in cancer care really doesn't mean just giving everyone the same tools, it means giving everyone the tools that work for them.
Right. Now, cancer care, as I understand, isn't just about hospitals or labs, but it extends further to the nurturing and the care that's provided by communities. How is Cancer Research Malaysia addressing this equity in care, especially as we talk about the ones being most affected that come from underserved populations?
I think it's really important, a point that you made, that cancer care isn't just about hospitals and labs. And because of that, I think we have to be very cognizant to the fact that patients and equity has to be in the heart of what we do, because cancer care doesn't really begin in the hospital. It begins within the community and also in the decisions that people make long before cancer symptoms even appear. So we've worked with government clinics, NGOs to deliver screening in low-income areas. We've co-designed AI tools to help rural health workers catch cancer earlier. And we've also trained patient navigators to walk with patients through the healthcare system, especially when language, location, and finances can be a barrier, particularly to the underserved and B40 populations. So to us, equity means recognizing that good science is not enough. It must go hand in hand with access for our communities.
Right. With World Cancer Day in motion and to raise awareness, the Exchange 106 at TRX will be lit in orange and blue. Tell us a little bit more about the significance of what's happening at this event.
I think for us, this is going to be very special because lighting up the Exchange 106 in the colors of World Cancer Day, which is orange and blue, is a symbol of national solidarity. I think everybody can see the Exchange 106 as an iconic building. So it's very visible reminder that cancer affects us all, regardless of our background. So when one of our Malaysians' most iconic buildings is lit up in the colors, it really sends a powerful message that cancer affects us all and addressing it requires all of us. So I hope that as people see the building lit up tonight, it will spark conversations about getting screened, about supporting someone going through treatment, and about supporting equity in access to diagnosis and treatment. It seems like a small act, but it is a big message that together we can make cancer less feared and talked about and more survivable. So we're really deeply grateful to the management of the Exchange 106 for this meaningful collaboration. By using this landmark to raise awareness, they are helping to shine a light, quite literally, on the need for prevention, early detection, and support for those affected. And these are not just colors on the skyline. We have to understand they represent lives touched by cancer and the collective hope that through action we can reduce the burden of this disease in our country.
Thank you, Prof, for sharing your perspective, and a special thank you as well to Cancer Research Malaysia for all the work that you and the team are doing in the fight against cancer. We look forward to speaking to you soon. And as we mark World Cancer Day today, Malaysia will witness a historic moment at the Exchange 106, that's at TRX, when it lights up in orange and blue. So get your phones ready later tonight, capture that moment, share it on your platforms and help spread the message of awareness, solidarity and hope.